According to World Health Organization, malnutrition and hunger are considered to be rampant among displaced populations and refugees. Currently, around 40 million people across the globe comprising of infants, children, adolescents, adults and older people suffer from one or multiple forms of malnutrition. To help address these challenges, nutritionists and dietetics are needed in roll out of food aid programs among other humanitarian interventions. Thus, undertaking a certificate in human nutrition and dietetics at Humanitarian Global gives you in-depth knowledge and understanding of Introduction to Nutrition. In this module, you get introduced to nutrition as a topic, learn the principles of nutrition, nutrition assessment and primary healthcare. Secondly, nutrition in the lifespan. You get to explore topics about the human anatomy and physiology, nutrition in convalescence, nutrition for pregnant and lactating mothers and nutrition in the elderly. And thirdly, meal planning. Get an introduction to meal planning, food safety, hygiene, non-communicable diseases and how to diagnose nutrition in a community. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
So thank you so much for joining our session today. My name is Anthony Mkui, the Academic Registrar at Humanitarian Global. We are about now to start our session. And as we look forward to a very great session, and I can see our expert for the day and our facilitator. She's very much ready to take us through. But before that, I would like just to give you an introduction, a small introduction for some of us who might be new, or maybe it might be their first webinar. When it comes to attending these first webinars. So I would like just to brief you on who we are as a Humanitarian Global Institute and what we do. And just to do that, and I'll take like 5 minutes. I'll try to be very much brief. Allow me to share my screen. So that's what I would like to do. And then I can project that. I'm going to do that in a few. Okay, great. So as you can see on my screen, this is just a snippet of what we do. And as Humanitarian Global Institute, we are based in Nairobi, Kenya. Our main focus has been to work with both humanitarian and development professionals like you. And our main agenda and focus is to ensure that we can promote quality learning and training so that you can be better equipped as you go on with your day-to-day activities in your respective role that you're playing in your organization. So just an overview of the areas that we focus on. One of them is training and learning. And this is a broad category that we do ensure that we can achieve that through our online courses, our training workshops. So that means we do have our online courses, meaning that whatever we cover today, it's just a small section of what you'd get once you join us for the online courses. So we have online courses from the certificate level, which is a course that will take a period of 3 months. We have a diploma level course for the same in human nutrition and dietetics, taking a period of 6 months, and also a postgraduate diploma level course in human nutrition and dietetics that would take a period of 1 year. In addition to that, we also work with institutions, organizations, so that we can offer training workshops. So that means you might be attending today, you have a team that you feel like they need to be taken through a certain area in this area of human nutrition and dietetics. So we can work with you in that capacity to ensure that we can come up with a bespoke training workshop for your team. Additionally, we also organize and host webinars like the one that we're going to have today. We also make sure that we can organize for virtual summits and also participate in capacity and team building events for organizations or even groups of individuals. Secondly, we ensure that we can promote and steer community development. And how we do this is to ensure by making sure and also very much possible that we can collaborate, we can partner with your organization, we can be able to see what you're doing, and then we can work together for the better good of our society. Thirdly, we do have a pool of experts from different parts of the world. And these are the consultants, the trainers that we work with. And that would mean that we can also work with you in the capacity of seeking advocacy or consultancy work. So I invite you, I welcome you, approach us, let us know what you're working on, the kind of projects that you are working on, and we will be very much ready to use our team and work with our team as well, so that we can help you achieve the goals and objectives of the projects that you're doing. Lastly, but not least of what we do, we ensure that we can promote and champion for humanitarian work. And how we manage to do so, we have created a platform that is going to help us interact with each other. We can share information, we can exchange ideas, we can contribute to each other's topics so that we can all get to learn from each other. So we believe in also learning from you. And that's why I would like to refer you to the Humanitarian Global website. And once you go to the website, you'll see there's a link for Humanitarian Global Community. So that would mean that once you join us, you can be able to join our forum, our community. And once you click on that link, you're going to be redirected to this kind of a platform. So this is a platform that would allow you to interact with other professionals. We do have various categories that we manage to offer training and learning in, and that is not limited to human nutrition and dietetics. We also do train on water, sanitation and hygiene, monitoring, evaluation, accountability and learning. We also do train on maternal, infant and young child nutrition. We also do train on procurement and supply chain management, disaster risk reduction and management, food security and nutrition in emergencies, and other areas as well. So you can always come, choose the class that, or maybe the forum that you want to join. There is the first topic, you can introduce yourself, and you can even create a topic of discussion. So you can see based on our previous topic that we've been able to tackle, we had even participants giving in their feedback, their contribution. And that is how we managed to make sure that we can share knowledge, we can help each other when it comes to learning. So I would urge you, as we continue the session, be part of this forum. This is where you're going to also interact with the facilitators at depth, meaning that if you have a question and maybe the time was not enough for us here to answer all your questions, you can go there, post them, and then we're going to respond to you. So as we look forward to starting the session now, I would like to say thank you so much for joining. As we continue, try and continue inviting your friends, your colleagues, share the link in your WhatsApp groups, in your professional forums and platforms that you might be part of, so that they may also join, and then we can get to benefit together as we continue learning. So this is an interactive session. Feel free to post your questions on the Q&A. Feel free to make your inquiries, and also we encourage you as we go on. Let's try and make sure that you can have a look at the other programs that we offer, the further training that we offer in these areas at the certificate level, the diploma level, and also the postgraduate level, so that you may join and get to pursue further skills in those particular levels. And with that said, I would like just also to reaffirm again about our stand on sharing your personal details. So we already have your personal details, so no need for you to share, and don't worry, because once we do the session each and every time, we ensure that we can share the recorded version in the YouTube channel, and that's very easy. Once you go to the website, there's a link to the YouTube channel, and after you click on that link, you're going to be redirected to our YouTube channel, and this is where you can find all the videos. So we have done very many videos, classes in different areas, even in this particular area of nutrition and dietetics, and you can always go there to review them. So thank you so much, and allow me now this time to invite the key facilitator for the day, Annette. So Annette, if you can hear me, the floor is yours, and you may continue. Thank you so much.
Thank you very much, Mr. Eric and Anthony. My name is Annette Mambo. I am a trainer and practitioner of nutrition and dietetics. And I'm happy to have you today to participate in our sessions so that we can discuss more. So I think we can start for the sake of time. So I hope the screen is visible. Somebody can confirm. Can you see the screen?
Yes, I can.
Okay, then. So I will begin today's session. We are going to deal with diet therapy. Diet therapy is a crucial part of anybody who is practicing nutrition and dietetics. So we are going to do an introduction part, and the agenda for today is introduction to diet therapy, meaning of relevant terms, a few of them. What are the objectives of diet therapy? Diet modification. What factors influence diet modification? And then we are going to look at the general therapeutic dietary modifications. So, what is diet therapy? Now, in very simple terms, diet therapy means treating using foods. We know diet is a combination of foods that we eat as a habit, but sometimes when somebody is in illness or somebody is unwell, they might have a need for a special diet which will promote their health. So when we change the normal diet and we tailor it to that person's need to treat them or to manage their condition, that is what we call diet therapy. So here, I have these notes here. We can just look at them. We'll be looking at the main parts. So we are saying broadly, diet therapy involves the alteration or adaptation of a diet to prevent or to treat a disease or to simply promote optimum health. Now, the dietitians, the professionals who are called dietitians, are the ones who are responsible for diet therapy, and their work is to counsel patients on special dietary modifications. They also develop dietary plans, that is meal plans, that they offer to these patients depending on their condition. And they also provide the dietary advice that is needed for a healthy lifestyle in order to promote health and to prevent disease. So when we are through with our course of the level, either certificate, the diploma, or even the post-diploma, we can be able to have some level of diet therapy, and we can work with our patients to counsel them on the relevant diets. So some terms that we are going to come across in today's session are as follows. Dietetics. Now, this one is a branch of nutrition. Remember, the course that is commonly offered in most institutions is called nutrition and dietetics. There is a difference between nutrition and dietetics. And very briefly, just to explain, nutrition is a scientific study of anything that happens from the time you consume the food until you eliminate the waste products. So it's a broad science which involves the study of foods, the components of foods, and how those foods interact with our health, and how they make human beings able to have energy, to grow, to repair worn-out tissues. All that is nutrition. But now there are many branches of nutrition, and one is called dietetics. And here we are defining it as a branch of nutrition that deals with the study of diets. That is why the word is also coming out from diet. And just to remind ourselves, a diet, those foods are comprised of the foods that we eat as a habit, and an appropriate diet provides for all nutritional needs of an individual at any given time, whether in normal health or illness. Then the other term here is diet therapy. Already we have now seen what could be diet therapy. And now we are being told that this diet therapy is also a branch of dietetics, which is concerned with the use of foods for therapeutic purpose. Remember, the word therapy means treatment. Other examples of treatments are medical treatments. We have physiotherapy. We have all types of treatments. But here we are talking about therapeutic diet, which are used for treatment purposes. So it is the use of the diet, that is now the diet therapy, in treating, in prevention, and in management of diseases and disorders. And this therapeutic diet is a term that we'll come across as we continue. will mean when we have modified a regular diet or a normal diet, the diet that is consumed by people who are healthy, who have no issue, we change it or we alter it to make a therapeutic diet. So that is why we are saying that it is modified or tailored to fit the special nutrition needs of a particular person. And then the other term here, we are saying regular diet. This can also mean a normal diet or a general diet. And when we talk about the regular diet here, we mean a well-balanced diet that is recommended for people of normal health who are not sick. And this diet comprises of foods that give us all the nutrients that are needed by the body according to the recommended dietary guidelines. So in short, it's a very well-balanced diet that can be consumed normally by people who have no problems. Now, nutrition, there are very many definitions of nutrition. Here I've just chosen to say that nutrition is a broad term, and it includes the scientific study of food intake, what's happened to the food once in the body, the elimination of the residue. Residue is what remains after the nutrients are absorbed in the GIT. What remains is what we call residue here, and how the nutrients are related to the health and disease of a person. So those terms, you can always go back to the slides that we will share you in case you want to clarify what I mean or what we mean by any term and check. So I'll move on to the next part of our agenda, where we'll look at objectives of diet therapy. Why do we do, or why do we practice diet therapy? So there are about 5. Forgive me for the numbering error there. So the first one is to maintain good nutritional status. Now, nutritional status is the state of the body as influenced by nutrient intake. Normally we say people are of a good nutrition status or a poor nutrition status. And this is determined by the way we feed. If you feed well, meaning a well-balanced diet, the scheduled times, then you are going to have a good nutrition status. And on the contrary, if you do not acquire all the nutrients from the foods that you consume, then you may have a poor nutrition status. So we do diet therapy to make sure that everybody has a good nutrition status. The second one is to correct nutrition deficiencies. Now, that may result from disease and disorders, or even from inadequate intake of the various foods that we eat in our communities. So, in case there is a deficient nutrient in our diet, it will result in a deficient disorder. I'll just give a simple example. If you do not consume fruits and vegetables, you might suffer from vitamin C deficiency, because that is where we commonly find vitamin C, which is a water-soluble vitamin. The disease or the disorder that is associated with vitamin C deficiency is called scurvy. So to correct that condition, you will need to have a sort of diet therapy in which the diet is going to be changed, and it will pay particular attention to increment of vitamin C in your foods. That's how you correct the condition. Number 3, we also have the diet therapy in order to help the body to cope or to have ability to metabolize the nutrients during illness. I will also give an example here and say that in some illnesses, I pick on maybe diabetes, we have a problem with glucose metabolism. The body, due to illness, cannot metabolize glucose in the proper way. because there is a problem with either the insulin, that's the hormone that is required to help metabolize the sugar, or the way the body reacts to that insulin. So in this condition, in a short statement, we have a problem with metabolizing sugar and carbohydrates. So what we do, we have to adjust the diet, paying particular attention to the amount or the type of diet that will help the body be able to metabolize that sugar in the proper way. In terms of diabetes, we are going to ensure that we are going to give the body just enough for it to be able to metabolize, since that is a problem. Metabolize means utilize. Those are the converting that sugar into energy. The next one, number 4 there, is to afford rest to the whole body or to specific organs affected by the disease. I'll just give a very small example there. If, for example, you have a disease like ulcers, or even an organ disease like a liver disease or whatever disease, I pick on ulcers, whereby you have a problem with them. You have ulcers, you have small type of wounds in your stomach or in your upper part of the intestines, then it means you have a dysfunctional GIT. So you will change the diet that will help your GIT system to rest. It will not have to work so hard in digesting food, in providing so much gastric juice, and in peristalsis, that is a movement. You give a food that is not going to involve so much digestion, so that the ulcers can heal. So that is why you need to change that diet. You modify it so that it can afford that part of the body or the whole body rest, so that it can heal. And then finally, diet therapy also helps to supplement medical treatments. And here I will just give an example that even when you are taking medicine for whatever condition it is, you need your immune system to work together with the medical treatment. So the immune system can only be made stronger, or it can work better when you provide nutrients that make immune cells, or that strengthen those immune cells that will help you now fight a particular condition of a disease. So in addition to the medicine, you also need to strengthen the immune system, and you do that through having a diet that can strengthen the immune system. So those are the objectives of the diet therapy. The next thing, we are now going to move to diet modification. I hope you're still with me. And all what we are saying here, that diet therapy is when we are trying to use diet in prevention, in management, and in treatment of illnesses. And in order to do that, we need to change or to alter the normal diet. And this is what we are calling diet modification. So we need to understand how to change diets in order to meet the special nutritional needs of individuals during illnesses. So there are 2 general aspects of diet that can be modified, and I've written them here. One way that you can modify diet is qualitative modification, and this affects the characteristics or the aspects of the diet, like the form, the physical, the way the diet appears. For example, and we'll understand this better because we have examples. For example, it changes the quality in terms of texture, consistency, how thick it is, in terms of like flavor. So here we are talking about the quality. of such characteristics, which we are going to look at more in details. And then we have the other aspect that we can modify diet is quantitative. Here we are talking about modifying the content, that is the amounts of some or all of the nutrients that are in a diet. Examples, we are going to see that some diets may need to be reduced in fat content, others we may increase protein content, others we may add more fiber. So here we are dealing with amounts, quantities, playing around with the quantities. And here is the physical characteristics of the diet. So qualitative is the quality of the diet, and quantitative is specific amounts that are there. So those are the two general aspects in which modification of diets can be done. Now, we might also want to consider what factors determine how we modify our diet. So the factors that influence diet modifications are as follows. Number one is the nature of the disease or disorder. So here we ask ourselves, if you are changing the diet, you have to know what condition is this person suffering from. Are they suffering from arthritis? Do they have ulcers? Do they have diabetes? Whatever condition they have, that one will be the number one factor that will determine what kind of diet modification that will be done, because a diet that you modify for cardiovascular disease is not the one that you can modify for another condition. So that is the first condition. Number two is the severity of the disease. Supposing it is the same disease, we pick on whatever, hypertension. How serious is it? So a person with very serious hypertension and one with very mild, a little bit mild hypertension, even if the nature of that disease or the type of the disease is the same, the way you modify, the way you change the diet will be a little bit different because of the severity, the seriousness of the disease. And the other one is the metabolic changes involved in the disease process. Now, when there is an illness, the way the body functions changes. From the normal body function, it changes to the body now does not function normally. So you have to think, this condition, what changes does it make to the body so that the body will not function the way it is? So I just give an example here. I'll just use the same example that I used for diabetes. When somebody has diabetes, they do not metabolize, or they do not use sugar as normal. That is why now you need to know that is a problem. The problem is the metabolism of sugar. And then when you are giving that diet now, you consider how can you help that person with their metabolic changes to acquire all the nutrients needed from a diet. How do you change it so that it can suit how their functions have changed? The other one is nutritional status of the individual. Now there will be a difference of about, you can just pick on any condition, a common cold. Somebody who is already having a very poor nutrition status and a good nutrition status, these people, if they got a common cold, when you are modifying their diet, it will not be the same for the two individuals. You will consider that the person with the poor nutrition status has two problems. They have the illness, that is that common cold, plus they have the need to improve their nutritional status. So you will be dealing with two problems there, the disease and the need to improve the nutrition status. While the person with a good nutrition status, and now they have developed a condition, it will be a little bit easier because now they already have good nutrition status. So you'll just be dealing with the illness or the disease condition. So those were the factors that we consider when we need to know how to modify diets. If it's not also clear, you can always continue to list your questions. Now, I'll then move to the general ways that we modify therapeutic diets. It is very important that you understand some of these, actually all of the general ways of modification, because this is the way it forms the basis of dietary modifications for many conditions. As we continue with this diet therapy, because this is an introductory part, we will start now considering various diseases. Normally we do them according to the anatomy and the physiology of the body. So for example, we might now look at the diseases of the gastrointestinal system. We might look at cardiovascular diseases, renal diseases, liver diseases. That's how we tackle these diseases. And when we are dealing with these diets required for those specific conditions, we will be mentioning this general therapeutic dietary modification. So it's very important that you understand, because if somebody has a condition and you are told to give them a diet that is high in energy, then you need to know what is that. So this is what we're introducing you of the general modifications. So there are several ways here. I have summarized them, and then we are going to go a little bit detailed in them. So there is change in consistency. Now, when we are talking about consistency, I would say this means how the texture of the diet, how thick is it, how hard it is to chew, to swallow, that kind of thing. And here we will see that there are 4 ways in which we can modify or we can change the consistency of a diet to make it therapeutic. We will look at how to make what is a clear liquid diet. You know, we can have clear liquid diets, full liquid diet, thick liquid diet, and soft diet. Don't worry, we will see what that is. We can also modify the fiber content, and we'll have fiber restricted or low fiber diet, and also high fiber diet. And then we have modification in energy. Here we talk about high calorie diet and low calorie diets. Modification in 1 or more nutrients content. We'll see how we could have a high fat diet, a low fat diet. Actually, we usually have a low fat diet. We could have a low protein diet, a high protein diet, sodium restricted, and diets. All those we are going to look in details. We could also modify a diet to be a bland diet. We'll also see what that is. We could also exclude certain foods, especially when somebody has allergies. Another way is to change the frequency of feeding. Here we will see some conditions may necessitate to have small frequent feedings instead of the 3 regular meals. Then we may see somebody having small regular meals like 6 or 7 meals per day, depending on the condition. And then we'll mention just a little bit about change of mode of feeding, because this one we do it another part of a topic called nutrition support. Sometimes patients are not able to feed normally because of the conditions that they may have. The normal way is oral way, where we put food in our mouth, we chew it and we swallow it and we digest it. But in some conditions, this may not be possible. So we may have to introduce food through tube, so tube feeding or enteral feeding. Or sometimes the GIT system is not even functioning, and therefore the patient cannot digest the food, and we might have to give intravenous feeding. Those nutrients may need to be introduced in the blood through intravenous feeding, which is a way that we call parenteral feeding. So all this we are going to look into details, and I will begin with the first one. This is change in consistency. Here, so how do we change the consistency of food in diet therapy? First of all, we are saying here we do this in order to provide a soft or liquid diet for patients, and it is done for conditions that affect the gastrointestinal tract. In this presentation, I might be calling it the GIT. So it means the same gastrointestinal tract functionality that may be necessitated mechanically is the ingestion and digestion of food. We need the food to be easy to chew and to digest and to, let's just say, an easy digestion. So that is why the diet may need to be changed to be soft or liquid. So here we can do it in 4 ways. The 4 common ways that change in consistency is done is, as mentioned there, I will repeat again, is to make the food a clear liquid diet, full liquid diet, thick liquid diet, and a soft or light diet. So let us start with a clear liquid diet. What is that? Where is it used? How can we do that? So there it is. So when we are modifying in consistency to make a clear liquid diet, this is done to provide, why do we do this? The purpose of this diet is to provide oral fluids in order to prevent dehydration for the patient and to relieve thirst. And this diet may have small amounts of electrolytes, that is some minerals, and calories in a form that requires minimal digestion. So this diet is for patients who have very minimal digestion. They cannot digest food the way it's supposed. So we provide a kind of diet for them that gives a little bit of calories and electrolytes, that is minerals, and a lot of liquid so that they do not get dehydrated. And as you can see, this diet does not have a lot of nutrients. Therefore, it is only indicated or prescribed for a short-term use, actually for around 24 to 48 hours. Beyond that, it will cause a lot of nutrition deficient for the patient. So we do it for a short time to allow the patient to heal or to carry out a certain procedure, as we are going to see, for a short time. So nutritionally, the depleted patients, those patients who have poor nutrition status, even if we put them in this diet, they should always receive an additional nutritional support, probably through supplements or through intravenous or parenteral nutrition, through drip, which we are going to look at later on in a certain topic. So there is a table here. I hope you can all see the table. In this table, we are going to give examples of when we can indicate or when a clear liquid diet can be prescribed and how the clear liquid diet should be, like the characteristics of the clear liquid diet. So the diet here, example of this diet in the first column here is example is black tea, broth, strained fruit or vegetable juices, etc. Indications or prescription. When is this diet prescribed? So these are some scenarios: pre and post operation, that is before and after operation. When you are doing a surgery, we don't need somebody to have food in their digestive system. It will cause problems because when we are using anesthesia, it makes somebody stop most of the bodily functions. So if there are foods present in the GIT system and the bacteria continues working on it, and before the person regains their fully functional state, it could be a nuisance. So before and after operations, we need the GIT system not to have food material. So that period, we can indicate this, or the diet can be indicated. Then it can also be indicated as a transition. That is when you are moving from an intravenous feeding intravenous feeding, I'm just going to use another term for our understanding is when we use drip, or another term is parenteral nutrition. For example, we need to have a patient who cannot digest food for some reason. Maybe they are in a coma, maybe they have their GIT system has surgery, so for some period they cannot digest food. So we introduce the nutrients in liquid form directly to the blood. A good example is like dextrose. That is glucose, and we make a small incision using a catheter in their blood vessel, and then we introduce the liquid that has the dextrose. So here, when somebody is coming out from that sort of diet, you don't just give them a heavy normal meal. They might move from the intravenous feeding, and then they go to a clear liquid diet for a few hours, and then they go to more complex diets until they are back to normal. The other way is when other liquids and solid foods are not tolerated. Some situations will make you not tolerate foods. During boil preparation, prior to diagnostic visualization or surgery. Now, in case somebody has for example, a scan or an X-ray, that period before you have that diagnostic visualization, you need to clear your GIT system to make sure that when the X-ray or the scan is being done, there's nothing else other than the free and empty GIT system, so that you can facilitate good images. And it can also be prescribed in the initial recovery phase after abdominal surgery. So before your GIT system regains nice functions, you can start giving clear liquid diet. So how is this diet? How should it look like? It should be composed of water and carbohydrates. And this is simple carbohydrates. Actually, this is sugar. It should be sugars. It should be a clear liquid at room temperature. It should leave minimal amount of residue in the GIT tract. That means it should not have fiber. It should not have, after digestion, it should not have anything that is not absorbed. It should have no wastes that are left in the GIT system. And because of its nature, you can see this diet, even when taken for the whole day, it only provides very little calories, 400 to 500 kilocalories, which are not adequate for a normal person. You know, a normal person may need anywhere from 2,000 calories, depending on their size and other factors. And it can only give 5 to 10 grams of protein and 100 to 120 grams of carbohydrates in simple sugars. And it has no fat, absolutely it has no fat. It should be of low concentration. What are we saying there? For example, if it is black tea, it should not be so concentrated, not too much black tea that is soaked. It should be dilute, that's what we are saying. Then you are being told here, because most people make mistakes, that milk and the milk drinks are not allowed in these clear liquid diets. You don't give milk or milk drinks. And to improve energy level, you could add sugar. That is pure sugar. And of course, we just comment that we say it is nutritionally inadequate because it does not have all nutrients. So examples of this clear liquid diet is here. There's a picture there. There's water, there is coffee, there is tea. This is black tea or coffee, which you might add sugar, but no milk, no creamer. Broth, we have many types of broth. You could have, let me just use lay term. You could boil some bones or some vegetables, and then you strain. Make sure that you strain using the smallest, the finest strainer to make sure that there is no fat, there is no fiber that passes through. That is what we call broth. And then other things that are used to hydrate and to make sure somebody has some sugar, there is some popsicle, the one that we know that kids like. Gelatin, very commonly used in the developed world hospital. It leaves no fiber. Sports drink, they are allowed. Sometimes even fruit juices like lemonade with no pulp. You have also strained it and make sure that there is no fiber in it. So those are the examples. Now the other type, the other way we change in a diet inconsistency, we have said the first one is to make it a clear liquid diet. Now the second way is to make it a full liquid diet. And why is this done? This is done to provide nourishment in liquid form. We are trying to give almost all the nutrients in liquid form. But at the same time, you are paying attention to make sure that you facilitate digestion and optimal utilization of those nutrients provided in the diet in the acutely ill patients who are unable to chew or swallow certain foods. This diet is usually used as a transition between the clear liquid diet, the one we have talked about, and a soft regular diet, the one that after this diet, the patient now can go to a soft regular diet. Now in patients with hypocholesterolemia, as the word is being read here, you can see it means hyper, that means a lot of cholesterol in the blood. That is a lot of cholesterol in the blood. The full liquid diet should be modified to have low fat, because somebody might have high cholesterol because of consuming a lot of saturated fats, animal fats. So you do this by substituting these high saturated fats with low fat dairy products and polyunsaturated fats and oils. This is vegetable oils and low fat dairy products. Leave the saturated fats, those animal fats, because they contribute to high cholesterol. Then increasing protein and caloric value of full liquid diet becomes necessary when the diet is to be used for a period extending 2 to 3 weeks. So if it is to be used for a long time, make sure that you increase the protein and the total energy value so that it can be adequate for the patient. So when is this full liquid diet prescribed and what are the characteristics? So examples of this diet include soft desserts from milk and eggs, pureed and strained soups, ice creams, milk or yogurt, etc. There are other pictures that we will see. Indications for post-operative patients. Patients who have just had surgery, they have had the clear liquid diet, and now they want to increase their capacity of digestion, so we give them full liquid diet. And then following surgery also of the neck area, they are not able to chew, they are not able to swallow, we can also give the full liquid diet. How is the characteristic of the diet? It should be liquid at room temperature. It should be free from condiments and spices, things that add flavor, salt, tomato sauce, all those. It should be free from, it provides from between 1,500 and 2,000 kilocalories per day. That is why it could be quite adequate to provide calories for some patients. It has a large percentage is in milk-based and lactose intolerant individuals. Those individuals who cannot tolerate milk sugar, they need special consideration because milk is widely used in this diet. For those people who cannot tolerate it, maybe you could use an alternative like almond milk, those plant-based milks. And then the diet may be inadequate in micronutrients and fiber, because remember, it's a full liquid diet and we are It will not have a lot of fiber, and it will not have a lot of vegetables and fruits where we get micronutrients. So it may be inadequate. And therefore, if it is to be used for a very long time, maybe supplements should be considered. So examples of a full liquid diet, I have some pictures there. You could have some milkshakes, you know how you make milkshake. You can take the milk, maybe mix it with an avocado there and blend it very finely. Or maybe you can mix that with a banana or give the milk plain. You can have some tomato juice that is strained, or some fruit juice that is also strained. This is tea or coffee with milk. This is ice cream. This is a custard. You know, a custard, you can always look at the recipe in the internet, but it is a very soft kind of diet that looks like that, which is made from cooking some milk and eggs. You can always check the recipe from the internet. It is a kind of dessert that is commonly used in the Western world. So that could also be a full liquid diet. Then from there, and this is not to be confused with the full liquid diet, we have a thick liquid diet. In other words, this is a blended or a semi-solid diet. And just for your visualization, I've put some picture there of somebody blending food using an electric blender. So you are being told that this diet is moderately low in cellulose, that is a plant fiber, and connective tissue. It does not have a lot of connective tissues in order to facilitate easy digestion. Now, tender foods are used to prepare the diet. Most raw fruits and vegetables, coarse breads, that is whole breads, cereals, tough meats, and nuts are eliminated. Fried and highly seasoned foods are also omitted. So the purpose of the diet is to provide adequate calories, protein, and fluid for the patient who are unable to chew, to swallow, or to digest solid foods. So I've not given an example of the diet because it is this kind of thick liquid diet. It is any tender foods, a balanced diet that is tender, but then you have blended it, or you have liquidified it, and it's a thick. I'll show you a picture. So it's prescribed or indicated after oral surgery. You can imagine somebody has some part of the mouth has undergone surgery, or they have had plastic surgery on the face, and therefore they have problems with chewing or swallowing. So they need a blended food. For acutely ill patients and those with oral, esophageal, or stomach disorders who are also unable to tolerate solid food, those progressing from full liquid to a general diet, patients who are too weak to tolerate general diet, those whose dentition, that is teeth, is too poor to handle foods in a general diet, and those for whom a light diet has been indicated, that is after operation. So characteristic of this diet is as follows: fluids and food blended to form a liquid, a thick liquid. That should be noted, not just a liquid, but a thick liquid. All liquids can be used to blend foods. However, nutrient-dense liquids with similar or little flavor are preferable. So some of the liquids that can be used include gravy, vegetable juices, cream soups, cheese, and tomato sauces, milk and fruit juices. Those are some of the ones that are recommended because they are not just liquids, but they are also nutrient-dense. They have nutrients. You could also prescribe a multivitamin to supplement the diet. A multivitamin and mineral supplementation could be used to supplement this thick liquid diet. Examples. Now, I just wanted you to see the consistency because we are talking about consistency here of this diet. When you blend the food, it should look something like this. in these little bowls that are here. And I've just given examples. Like the first one there, they say they have blended broccoli and some peas into that mixture there. You can see it's a very thick consistency. And the rice, the other one is carrots and cheese, and the other one is rice and cucumber, something like that. Now, I just also needed to point out something here, because any patient who is being fed on a thick liquid diet, it may necessitate frequent feedings, 6 to 8 feeds per day, to facilitate ingestion or adequate calories and protein. Now, blended foods should be used immediately, but can be refrigerated up to 48 hours or frozen immediately after the blending to prevent growth of harmful bacteria. You know, when you blend food, you increase its surface area, and therefore it can easily have bacteria, harmful bacteria, the pathogens multiply in it. So whatever it is, blended food should be used immediately or just refrigerated immediately for not a very long time, or frozen, so to prevent contamination. The final type of way that we have consistency modified is to have now the soft or light diet. In many hospitals and for many recovering patients who can fully eat, this is the kind of diet that we give there. It's called soft or light diet. And what is this? Now, this diet is designed to provide the nutrients for patients unable to tolerate a general diet, in which mechanical is in eating. This is physically chewing up the foods and swallowing up the food. Digestion or both are desired. This diet should be individualized. It should be made for special needs of the individuals based on the type of the illness or surgery and the patient's appetite, chewing and swallowing ability, and food tolerance. So I have a picture here of just to demonstrate what we mean by soft or light diet after we look at the prescription and characteristics of the soft diet. So this diet will include a variety of foods. I've just indicated them there. These foods will make a balanced diet. For example, fruit juices or cooked fruits. Now you can see the term here is they're using cooked fruit, meaning that it is softer version of the fruit. Well-cooked cereals, strained if necessary. Fresh green leafy vegetables like spinach, amaranth, pumpkin leaves, etc. Strained peas, without the fiber. Potatoes, which can be baked, boiled, or mashed, just for you to have an idea. Light fats like butter, thin cream, milk, which can be plain or scrambled, which can be in scrambled eggs, in soups, in simple desserts. Eggs, which should be soft cooked. If you are to boil an egg, it should be soft boiled, not hard boiled. Indications, it is for patients who have undergone surgery, patients with mild gastrointestinal problems, not very serious problems of the GIT, and surgical patients whose dentition, they have problems with their teeth, they cannot chew very well, and for transition from the thick liquid to a general diet. So the characteristics include moderately low in cellulose, that is the fiber and connective tissues. Tender foods may be highly seasoned if desired. Food texture range from smooth and creamy to moderately crispy. Most raw fruits and vegetables, coarse breads and cereals, gas-producing foods, and tough meats are eliminated. Fried and highly seasoned foods, strong smelling foods should be omitted. So this is my example of a soft or light diet. So I have used the same foods to show you. So this is a balanced diet. I have minced meat here, minced beef, lean beef. I have cooked spinach, and I have mashed potatoes. So this is like a nice balanced diet. The same diet now, this is makes a soft light diet. And then we have the regular diet. You can use the same food now in a regular diet. You can see here we have some steak, a nice roast of beef. We have some vegetable salad, and we have some fries with tomato sauce there. So this is basically the same foods that have been used, but you can see the soft diet, there's a difference with the regular diet. So that's what we mean. So just before I move in, we are dealing with the first way in which we can modify the diet. And we said one general therapeutic modification of diet is to alter or to change the consistency. And you change it in 4 ways. You can have a clear liquid diet, a full liquid diet, a thick liquid diet, and finally the soft liquid diet. So make sure to go through the notes and familiarize yourself with those 4 ways of interfering with the consistency. So we have now number 2 of general therapeutic modifications. We can modify the fiber content. Now, just to remind ourselves what is fiber. Fiber is a portion of carbohydrates that is not capable of being digested by enzymes in the human digestive tract, thus contributing to increased fecal output, feces. Now, we call this residue in our nutrition. Now, residue is the dietary elements that are not absorbed following digestion. After you digest and absorb the nutrients, whatever is left, that is what is called residue. And whatever is left will include whatever the human enzymes cannot break down, that is, cannot digest. And these, in many cases, are fiber and connective tissues. Now, the diseases affecting digestive system generally require modification in fiber content. You know, the GIT system is the one that is involved in the digestion of foods. So diseases that affect that the ones that may require the modification of fiber. So there are 2 ways in which we have fiber modification. We can have fiber restricted diets or low residue diets or high fiber diet. So we are going to start with the way number 1 here, A, fiber restricted diets. Now this diet is composed of foods containing low amounts of fiber, which leave relatively little residue for formation of fecal matter. Now we know what is residue. Those remains are whatever leaves very little remains after digestion. Is what we call fiber restricted diet. The diet excludes certain raw fruits, raw vegetables, whole grains, and nuts, high in fiber, and meat high in connective tissue. The purpose of this diet is to prevent blockage of an inflamed gastrointestinal tract and reduce the frequency and volume of fecal output while prolonging intestinal transit time. So that is why we give this diet. Sometimes you may have some type of inflammation in the GIT part or in the whole of GIT, and we don't want to block those sick or those unwell parts. So that is how we use this low fiber diet. And we are being told other things that it does is to reduce the frequency and volume of output, and also it prolongs the time the food stays in the digestive tract. And this could be good sometimes when it is necessary, for maximum nutrient absorption. When we need somebody to absorb minimum nutrients from the food. So if it were to stay there in the digestive system for a longer time, then digestion still is ongoing and absorption is ongoing. Unlike if the food is moved so fast along the GIT system because it's being pushed and by the fiber. So that's what we need. So here I have a picture of to give you a way that you could do that. It's all about creativity and imagination. So this diet does not have to be low in other nutrients. The only thing we need to get rid of, if possible, is the fiber, by all means. So there's a picture here. I'm showing somebody is preparing some tomato soup. And this is a procedure. You can see they're using, they are straining the juice. They have made a juice and then they have poured it in a kind of strainer or sieve, and they are straining out, they're removing the fiber. So finally, the person eating this vegetable, called the tomato, will end up with all the goodness other than the fiber. The same here, this is a capsicum and there's some vegetable which I'm not even familiar with. Maybe from where you come from, you know this vegetable there. So they have used the same way. They have just put some liquid and then they have strained out the juice. So that is one way that you can do that. So where the diets, anything that you have removed fiber and connective tissue, that is the diet. Indications, it is prescribed in many gastrointestinal disorders like colitis, inflammation of the colon, colostomy, that is some surgical procedures that may occur in the colon, inflammatory bowel disease. From the word here, you can see it's inflammatory, meaning that part of the GIT has been inflamed, so it is not okay. Diseases like diarrhea, like hemorrhoids, acute phase of diverticulosis. These diseases should not worry you because remember, this is an introduction to diet therapy. And when we start dealing with conditions, we are going to start with the GIT diseases. So diverticulosis is some forms of poachings, extended poachings that are found in the intestines. And because I know we are good learners, we are going to note this, go to the images of the internet and view. I cannot have better words to describe. Just view a real picture, not even an animation. You'll see what I mean. And when we talk this, it occurs in adults, especially who are older than 40 years. Ulcerative colitis in the initial stage. Here you can see ulcer. We know ulcers are like small types of wounds that could be found in the GIT. Colitis, if you see anything ending with TIS, it means inflammation. So this is inflammation of the colon. At the same time, it's also having ulcers. That's a very bad condition in its initial stages. And then the other condition like partial intestinal obstruction, pre and postoperative periods of the large bowels, convalescence from surgery, trauma, or other illnesses before returning to the regular diet. So these characteristics of the fiber-restricted diet is that they should be low in complex carbohydrates, has refined cereals and grains. Now you can choose, instead of whole grain rice, you have the white rice. Instead of whole maize, you have the refined white flour. And then you should keep away from legumes, seeds, and whole nuts. They should be omitted. So we have given an example of very white rice, refined rice, in comparison to the brown rice. Then high fiber foods. This diet contains large amounts of fiber that cannot be digested. Fiber increases the frequency and volume of stools. Some of the purposes is to prevent constipation and slow the development of hemorrhoids reduce colonic pressure, prevent segmentation. This colonic pressure means pressure on the colon. Now, you know, when you don't have enough fiber in stool that is forming during digestion, it is segmented into small hard balls, for lack of another word, small, tiny, you know, which, because of the way they are hard, they put pressure to the colon. And that's also very good because they can weaken the colon and it could lose its elasticity. And then another good purpose of a high fiber diet is it reduces the serum cholesterol levels by decreasing absorption of lipids, reducing transit time, and can be used to control glucose absorption for diabetic patients and overweight clients. Dietary fiber is also very important because it reduces the risk of cancer of the colon and the rectum. Now, before I proceed to the other type of diet, we would like to look at after we look at the indication and characteristics of the higher fiber diet, we will like to answer some of your questions and also comment on what we have done. So this diet, the high fiber diet, is indicated where we have some type of gastrointestinal disorders like diverticular disease, in cardiovascular diseases, in cancer prevention, in diabetes, in weight reduction. Characteristic of this diet is that it is high in complex carbohydrates. It has less refined cereals. Example of high fiber foods are fruits, nuts and seeds, avocados, peas, beans and legumes, whole grains like oats, barley, maize, millet, all those, leafy green vegetables, and root vegetables. Those are a few examples that I have picked for you there so that you can be familiar. So before we move on to the third way, and the rest of the ways now, we'll move a little bit faster. Let's have a break.
Food and Agriculture Organization of the United Nations states that malnutrition and food insecurity have contributed to an increasing frequency of crisis events as well as vulnerability of many communities across the globe. Nearly half of the world's population suffers malnutrition, yet there is little official development assistance that goes to nutrition. Hence, there is a need for training more humanitarians to help them acquire right knowledge and understanding needed to administer good nutrition and diet to millions of people across the world. Undertaking a diploma in human nutrition and dietetics prepared by Humanitarian Global gives you in-depth knowledge and understanding of nutrition care process. In our first module, you get to learn and understand the nutrition care process, general body metabolism, nutrition epidemiology, assessment and surveillance. Secondly, components of nutrition. In the second module, our participants get to tackle topics including micro and macronutrients, nutrition in emergencies and non-communicable diseases. Thirdly, diet therapy and meal planning. In the third module, participants also get to learn about diet therapy, meal planning and food production for invalids and convalescents. Fourthly, environmental and public health. In the last module, the learner will get to learn more about environmental health, nutrition in public health, measures of morbidity and mortality and communicable diseases. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Yeah, I think we can start by answering the two questions you have on the Q&A, as I also urge our participants to send the questions to the Q&A and not the chat. Kindly send your questions to the Q&A and not the chat. The chat is becoming a beehive of activities and we do not want to miss out on your question. So maybe Annette, we can start with the two questions as a few more people will send to the Q&A.
Okay, thank you very much, Eric. And thank you, participants, for your questions. I'll start with the first question here from Abdrazak Mohammed Isaac, who is asking, what is the difference between diet therapy and therapeutic diet? That is a very good question. Now, when it comes to grammar, of course, it's not our native language, but I'm going to try and answer this question. It's a matter of diet therapy is the practice. It is when you are using food to treat. That practice, when you're using food to treat, to manage, and to prevent diseases and disorders. Now, therapeutic diet is the food that you are using to treat. It's just the way you have written it there, diet therapy, as the reverse of therapeutic diet. That is basically the difference. Diet therapy is the practice, and therapeutic diet is the food. So, Mohammed Isaac, is that satisfactory? Okay, we'll get a response from him, but I hope that it is an okay answer. Now, Alex Akaka is also asking a question here. What foods that is in diet therapy are recommended for a client with both diabetes and hypertension? Okay, this is also a good question, but we are doing introduction to diet therapy, so I can assure you by the time we are through with all the diet therapy, which is 1, 2, and 3, we will know. But just to mention, there is a diet that can take care of both of these conditions, and it's called the DASH diet. DASH, D-A-S-H, meaning dietary approach to stop hypertension. DASH diet, dietary approach to stop hypertension. Now, I hope you are noting that down, because I would like you to Google what that means. It will tell you very shortly that it is a diet that is full of whole foods, that is has lean meats, that has little healthy fats, that has little sodium, that is salt, kind of characteristics such as that. So you use whole foods, you use lean meat. If you must use red meat, it must be lean, otherwise the recommended one are white meat. And then you use very little healthy fats for cooking, and then you limit the amount of salt. It's characterized by that. It is called the DASH diet, dietary approach to stop hypertension. Please check examples of such diets in the internet. I hope also that has answered that. There is a question from Okot Ribbon. How do I use food checklist and recommend percentages for diet modification? Now, this is also a good question. You are referring to a topic that we'll also deal with called meal planning, where we might have checklists, certain checklists to recommend or to help us plan diets for our clients and patients. Such lists are very, very common for diabetes patients. And such lists will compare foods, both types, common groups of food that give similar nutrients, especially macronutrients, at a certain amount. For example, it will tell you, you can either use, I'm just giving it an example, you can either use rice or potato or mashed or yam or cassava or some cereal like maize or whatever. And then now what they have done in such list is given you the amount of rice that is equivalent to the amount of potatoes or yams or cereal flour that gives you similar macronutrients. So what this food list help you is to give a variety of foods, similar foods in different categories. The food list has different categories: protein foods, cereals, fruits, which you can now equate to each other. If you are using fruit, you have a fruit like grapes, you cannot equate just one small grape to one avocado. So they might tell you, if you are considering to get vitamin C, you need to have this patient consume a bunch of grapes, which could give you similar amounts to one avocado. So they have put this list to help us to recommend foods to our clients. Now, do not worry, because when we do meal planning, I plan to give you an example using the list itself. But I hope that for now it is clear.
Annette, maybe one more question and then we can go back so that we can finish. I can see the participants are sending questions.
Yeah.
We can also, yeah.
All right, it's okay. There is also a question here. Somebody is asking, what advice can you give to someone with the condition ulcerative colitis? So these are conditions that is characterized by both ulcers and inflammation of the colon. If there is a problem with the colon, I have kind of mentioned that they need a low fiber diet, a diet that is easy to digest without fiber, so that it may not harm the inflammation, block the inflammation, and it may not harm the small wounds that are already there. But not to worry, Ajak, you are not to worry. We are going to cover this in detail when we do our topic in diet therapy in conditions of the GIT system. We are going to mention them all, including this ulcerative colitis. We are going to show pictures so that we can have an idea what that is, and then we are going to recommend the diet. So for the sake of time, let's say that that can be covered in detail, but for now, I'll just give that short answer. Now, let's go back to our presentation. Then we'll continue with the question at the end of the question, but you can still continue posting them. So far, we have covered 2 ways of diet modification. The first one was consistency. The second one was fiber. And now we want to do modification, or to learn how to diets can be modified in energy intake. Here, energy can be either you can provide a lot of energy, total energy by food, or low energy. So that's why we have high or low calorie diets, depending on the needs of the individuals. So I'll start with the calorie restricted diet or the low calorie diets. Now, the purpose of these diets, they are prescribed for weight reduction for people who want to reduce weight, they are overweight. The recommended kilocalorie level is 20 to 25 kilocalories per kilogram of body weight per day. Now, for the typical standard of energy requirements for normal people is about 30 to 35 kilocalories. But now if you want to reduce, you give a person 20 to 25 kilocalories per kilogram per day. Now I will use an example here just to, supposing we have somebody who is very overweight or obese, depending on their, of course, we'll know if they're overweight or obese, if we work out, if it's an adult, if we work out their BMI. So supposing we have somebody who is 100 kilograms. What we mean here, we'll calculate the kilocalories that they need by taking their kilograms. That is why we are saying 20 to 25 kilocalories per kilogram of their body weight per day. This is where I am. So we are going to say their weight is 1 kilogram, 100 kilogram, and then we pick on 20 calories per each kilogram. So we will see that we will do 20 times 100, and we'll get a figure of 2,000 kilocalories per day. The dietitian, who is you, is now going to plan a diet, a meal, that at the end of the 24 hours that does not exceed the 2,000 kilocalories. And at the end of the session with your client or your patient, they will have a meal plan for several days of the diet that they will be consuming to maintain that kind of kilocalories, which will help them now reduce their food consumption and caloric intake, and they can reduce the weight. Now, generally, this diet should comprise of complex carbohydrates, and should provide 50 to 60% of the total calories. Now, these complex carbohydrates are those fibrous foods, the ones with whole grains, the vegetables. They are the ones we are saying that the food should consist about 60% of this food that you are consuming, the total calories. So when you look at the example, it's what I mean, and it should be low in fat. You should not have more than 30% of the energy that you are getting from this food coming from fats. It should come from this total, these complex carbohydrates and the protein. So let's look at the indications and characteristics. Examples of this diet, we have been told it will comprise of vegetables and whole carbohydrates. Please note there is whole carbohydrates. And then the indications, it's for those people who are overweight and obese, for those people who may have hypertension with excess weight, for those people who may have hyperlipidemia, this means very high levels of lipid in their blood, for the patients of diabetes mellitus with excessive weight, for the gout patients, and for gallbladder diseases preceding surgery. Remember, the reason why gallbladder disease may be here, when you do your unit called Human Anatomy and Physiology, you understand the various parts of the body and their functions. You will know that the gallbladder stores the bile. And bile is used in the digestion of fats. So if you have a gallbladder issue, it may require you to reduce fats in your diet and to have a diet that will not increase fat in the body. Characteristics of the diet, it should provide 20 to 25 kilocalories per kilogram of body weight per day. I use an example there. I hope you can remember that. It has complex carbohydrates, high dietary fiber, and the protein should be within the DRI, that is the dietary recommended intake. Now, when you are doing diet therapy, there is something that I should just mention. You cannot be a good dietitian if you do not understand nutrition. You need to be fully aware of nutrition, or to understand nutrition, so that you can now practice dietitian. So when we say that the protein should be within the dietary recommended intake, by now you should already know how much protein an individual should take per day. But I will just tell you for now that it is between 0.8 to 1 gram per kilogram of body weight per day. Actually, we have been saying traditionally that 0.8 for females and 1 gram per kilogram of body weight for men of protein. And this should not be confused with the food. If we are getting a protein from beef, meat, we are not saying you take those grams of meat. We are talking about the protein in meat. So when we are doing human nutrition, we will also clarify how to calculate that. So examples of these nutrient low calorie foods are as follows. Now, I've used a common serving of 100 grams. This is what I'm saying. So if you eat 100 grams of all these foods, they will give you the calories indicated by the numbers. You will look at the picture, but I'll just point out a few. This is cucumber, the first one, the one that I'm pointing at. If you take 100 grams of raw cucumber diced, it will only give around 16 calories. Berries, around 30 kilocalories. Carrots, that's 100 grams of carrots will give you 42 calories. So look at these numbers, you see they are very less. Those are the ones we are talking about being low calorie foods. The other one, energy modification, is when we have a high calorie diet or a high energy diet, and this is recommended to provide an energy value above the total energy requirement per day in order to provide for regeneration of glycogen stores and spare protein for tissue regeneration. So what we are saying here in simple terms is there is that amount that this person requires, an adult person requires, but now when you give high calorie, you give slightly higher than the normal requirement for those purposes there, so that the person can store more energy in terms of glycogen, and they can spare their protein for the protein purposes and use the energy to provide the energy for those processes. Now, for effective metabolism, an extra 500 kilocalorie of the recommended dietary allowances is recommended per day. Just to clarify this point now, some people make a mistake, especially people who decide they are going not to visit a dietitian and they are going to add weight by themselves or to reduce weight. They add too much. In order for the body to cope, you cannot add 1,000 or 1,500 or 2,000 to the amount that you're already taking. You do it bit by bit, and we are saying you add an extra of only 500 kilocalories. You do this gradually. You start with 500 calories, you see how the body reacts, the body gets used to that. If you need to add more, then you can add more over a period of time, gradually. So you don't just add too much of the calories. It will bring metabolic problems. Now, energy-dense foods are used to avoid complication of a bulky diet. So here we are saying you choose diet that is very high in energy, but you don't have to consume so much of that diet. I'll give examples of what I mean. Just keep that point for now. In case of poor appetite, the patient should have small servings of the high reinforced diets or foods. You know, those high energy dense foods, they should have small servings in case they do not have an appetite. So this is what I need. First, we look at the indications. So the diet here, we are saying energy dense foods, which include butter, sugar, honey, ghee, which are added to the normal diet to increase energy content. Now, I will just pick one there. If I have a cup of porridge, I hope we all know what is porridge, and I add some butter, and then I also add some sugar. Probably I also add some honey. Or that 1 cup of porridge is going to be very high in energy. I have not changed the cup of porridge, but I have changed the energy of that, or the caloric level of that cup of porridge, just by adding these ingredients there. So when we talk about energy dense diet, we are not talking increasing in the amount of food, we are talking about increasing the amount of energy in a food. So the examples in which these diets are prescribed, we have hyperthyroidism, wasting, typhoid, malaria, HIV, and all cases of prolonged degenerative illnesses. Now, increase kilocalories energy, you give 35 to 40 kilocalories per kilogram per day in adults. So that is the range on how you increase. Now let's just look at an example. Now this is also 100 grams of these foods, the same serving size we are talking about. Now, if you have 100 grams of nuts, sorry that the picture is not clear, but I just hope it will work. Just 100 grams of nuts will give you 660 calories. Just 100 grams of avocado will give you 149. Peanut butter, look at the peanut butter, just 100 grams, that could be like 2 tablespoons, may give you around 620 calories. Now, if I were to go back and compare what I was talking about, these are the low calorie foods. You pick on a food like broccoli, which is only 100 calories, the same amount when it comes to weight, it will give you 40. And then you compare now with these energy dense foods. That's what I mean when we talk about high calorie dense foods. The amount is the same, but it's giving off so much calories. So that's a way that you can modify food when needed to be low or high calorie. The fourth way is modification in the content of one or more nutrients. Now, the purpose of this is to increase or reduce the intake of specific nutrients depending on the patient's nutrition and health status. There are a number of ways to do that. You can moderate fat diet or fat restricted diet, that is low fat. In other terms, we are talking about you can have a low fat diet, you can have a high protein diet, a high calorie diet, you can have a high or low protein diet. You can also have, this is the same, sorry, you can have low sodium diet, and you can also have a high carbohydrate diet. You can play around with the specific nutrients there. So these are examples, and I give example of fat restricted diet A. Now this one limits the amount of fat consumed each day, and it's for patients who experience symptoms of nutrient losses when high fat foods are eaten, and may also be prescribed in conditions that make it difficult for the body to digest fat. Fat restricted diets minimize the unpleasant side effects of fat malabsorption, such as diarrhea, gas, and cramping. When you are not able to digest fat, then one of the symptoms is to diarrhea and to have a lot of gas and cramping. Whether this diet is adequate or not, that is what we are talking when we say adequate. Does it provide all the nutrients? And here we are saying that it is possible to meet the nutrient requirements of this diet. However, depending on how long the diet is followed and how much the fat can be digested, a supplement may be recommended. That is a oil-based supplement may be recommended. Patients with prolonged steatorrhea, that is diarrhea that is characterized by fatty material or diarrhea, may develop vitamin or mineral deficiencies. Vitamin A, D, E, and K. In human nutrition, we know that vitamin A, D, and K are fat soluble, which means they need fats to be absorbed. So if a person stays for a very long time on a fat restricted diet, they may suffer vitamin deficiencies, especially the fat soluble vitamins. So that's why we are saying supplementation may be considered. So some of the indications and characteristics of the diet is that where we have gallbladder diseases, where we have biliary tract lymphatic system, that is something to do with the liver, the hepatic cirrhosis, pancreatic insufficiency. Remember, the pancreas is the one that produces enzymes that digest fats. So if the pancreas has a problem, it's not sufficiency, then we will have to reduce the amount of fat in the diet. malabsorption diet. Some people have problems with absorbing the fatty acids, so the diarrhea, the fat, the condition we are calling steatorrhea, that will also make us reduce the fat. Intestinal resections, you know, some people, because of some damaged sections of the intestines, they are cropped out or they are cut out, for lack of a better word. It may have problems with digestion of fats. So all that will make us consider a low-fat diet. Being overweight and obese, cardiovascular diseases, bloating, diarrhea, steatorrhea, all that are some of the prescriptions of a low-fat or fat-restricted diet. And then characteristics of this diet, you are being told it can provide somewhere between 25 to 50 grams per kg of body weight per day. This diet is tailored to provide less than 30% of total calorie and less than 10% of saturated fat. We are just saying here that the fats should be very, very little there. And it will depend with the severity of the condition. So we have mild restrictions, we have moderate restrictions, and we have severe restrictions. We check there. And then the base of the diet should be composed of grains, that is whole grains, vegetables and fruits. Meat, fish, poultry, and eggs should be limited to 180 grams per day. We are just saying limit, especially red meat. You limit this because animal products usually also have fats. So another modification of content is we could have a high protein, high calorie diet. And this one is modified or changed to provide high amounts of calories and protein than the usual diet. It is prescribed where tissue regeneration is required. Now, the purpose of such kind of a diet, where it has higher calories and protein, is to help to heal wounds, to maintain or increase weight, to promote growth, to decrease respiratory complications, to resist or fight infections and support the immune system. For a high protein diet, adequate energy from carbohydrates and fats must be supplied. And this is in order to spare the protein so that you do not use the protein for energy, but you spare it to do the job that is required to repair tissue or for growth. Indications is febrile conditions, that is in fever. Febrile is when you have fever. Cancer, wounds, burns, tissue injuries after surgery, acute and chronic fever, especially in conditions such as TB, malaria, and typhoid. And then certain physiological alterations. Well, you know, there are some physiological stages where you require more calories and protein, like in pregnancy and in lactation and in infancy. These are stages that require very fast growth. So you will require more calories, more energy, and more protein because of the tissue regeneration or tissue growth that is required there. Characteristic of the diet there is that the diet must provide adequate protein carbohydrate ratio of 2 to 1. You are being told if it's a ratio of protein to carbohydrates, it should be 2 to 1. The diet should provide enough calories, that is 35 to 40 kilocalories per kilogram of body weight. And then it should provide high protein, that is 1.5 to 2.0 grams per kilogram of body weight. Remember, I had already mentioned here that the normal proteins required by an adult man is about 1 gram per kilogram of body weight. So here you are being told you will increase that amount to 1.5 to 2.0 gram per kilogram of body weight. It should consist more of high biological value protein. When you are studying protein, you will come and classify, one way you classify that protein is low biological value protein and high biological value protein. In simple terms, high biological value protein is a protein that has all the essential amino acids. The basic components of proteins are called amino acids. So if a protein has all of them, it is of higher biological, because if you feed that protein, it will give you all the components of the protein that you need. That is the amino acids. A low biological value protein, it lacks some of the amino acids. And if you consume it, you might need to consume another type of protein that could give you the missing amino acids. So when we talk of high biological proteins, normally these are the animal proteins. Low biological value proteins are the plant proteins. That is also to be learned and understood very well in human nutrition when we continue with our nutrients. So another type of content that you could also do is a low protein diet. And here you lower the protein. And the reason you do that is so as to temporarily, or that low protein diet is temporarily prescribed to avoid the breakdown of tissue protein, which can lead to undesirable level of nitrogen constituents in the blood. What we are saying here, when you break down protein, which you have already consumed, it has some nitrogenous wastes. So some disease conditions are not able to clear or to remove those nitrogen or nitrogenous wastes. So that's why we are saying you need a low protein diet, because we don't want those wastes that result from the metabolism of the protein. So some of the indications that are is when you have hepatic coma. Actually, the conditions that will make you have a low protein are conditions of the liver, because the liver is also used, it's very much involved in metabolism of protein. And also, it's also the conditions of the kidney, because the kidney is involved in clearing or removing wastes, among them nitrogenous wastes from protein breakdown or protein digestion. So if you have problem with the liver, all these conditions here, hepatic coma, this means liver coma, acute and chronic renal failure, this is a disease of the kidney, liver cirrhosis is a disease of the liver, acute and chronic glomerulonephritis, this is a kidney disease. So those diseases of the liver and the kidney may necessitate to have a low protein diet. And we are saying here, this low protein may range from 0.6 to 0.8. Remember, the normal one is 1 gram per kilogram per day, but now you can see we have reduced the amount significantly there. So these characteristics of the diet should be low biological value protein. And here we are saying this is the plant protein. And the amount should be not too much. It could be only about 20 to 35 grams of protein per day. But this figure you calculate based on the weight of the person. Low sodium diet. Now, this one is a diet low in salt, dietary salt. And then the purpose of the low sodium diet is to control blood pressure in people who are salt sensitive, in order to promote the loss of excessive fluids in edema and assist and manage hypertension. So when you have higher levels of salt in your tissues and let's say just in your blood, you end up kind of retaining fluids in the body. And when you retain these fluids, even the blood volume increases. When the blood volume increases, there is too much blood. That means there is too much work for the heart to keep on pumping. You know, a larger blood volume will put extra work for the heart to pump and extra pressure on the walls of the blood vessels. So we need to reduce the sodium of people who are salt sensitive in their diet so that we can ensure that they do not retain excessive fluids, which can result into high blood volume. Something like that, which we'll also study and understand fully when we are doing cardiovascular diseases. So the diet, one of the facts that can make us to have a low sodium diet is by using unprocessed foods and beverages. You know, processed foods and beverages have a lot of hidden sodium, and reading the labels to make sure that we have low sodium foods, including bread and others. Indications is when we have impaired liver functions, when we have cardiovascular diseases, you know, severe cardiac failure, and kidney. When you have conditions of the liver, of the heart, and of the kidney, then low sodium diet should be considered. The characteristic of the diet should be, we are being told, it should have low processed foods, and then the diet should be low in canned foods, in margarine, in cheeses and salad dressings, and other measures like avoid adding salt to the food. Do not have a salt shaker, put very little salt. That's how the diet should be. And as we conclude, we'll now go to another way that the diet can be modified, a bland diet. Now, a bland diet is a diet that is modified to avoid irritation of any kind to the alimentary or to the GIT tract. Such diets are chemically, mechanically, and thermally modified. Now, in the bland diet, strong spices, stimulants, and strongly flavored vegetables and fruits that irritate should be avoided. The food should be served at room temperature. I want to dwell on these three words. A bland diet is one that is chemically, mechanically, and thermally modified. Now, what does that mean? Excuse me. That means it should not be chemically stimulating to the GIT system. Here, avoid food that, when we talk about chemically, it avoids chemical irritation. Avoid foods that are very acidic, spices, you know, such kind of stimulants like in a coffee, things like coffee, such foods. These are the ones that are chemically irritating. Mechanically irritating are rough foods, you know, raw vegetables, roasted maize, very rough nuts, and you know, those foods that can harm the GIT because they are very rough. They are not able to be broken down easily. Thermal means nothing that is too cold, very, very cold, ice cold, or nothing is very, very hot. Give food that is not too hot or not too cold. So that's kind of the bland diet. And you will see it is used very much in GIT diseases, especially ulcers. We give a bland diet for ulcers. And then the sixth way is of modifying diets is exclusion of certain foods. And here we do it when our patients are suffering allergies. So we'll just remove certain foods from the diet, whatever food the person is allergic to. You identify the food and then you avoid it in the diet. And the common allergic foods are protein foods. They include milk, that is protein in milk, eggs, peanuts, soya, and seafood. Those are some of the common allergic foods. So we remove them from the diet in order to provide the allergy. Frequency, and now we are coming to the end. This is our last slide. Then you could also modify the diet, the general modification of diet, by increasing the frequency of feeding. And in some disease condition, patients may not be able to eat very large amounts of food at one time. It may thus become essential to give smaller meals at frequent intervals, as in the case of fevers, diarrhea, and ulcers. In such cases, provide small but frequent meals. So it's a small picture there, that's kind of a small. So you give, instead of 3 big meals, you give 6 to 8 small meals with a small intervals. And then at the end of the day, the person will have consumed the amount of food that they are supposed to consume, although in small, frequent amounts. And the last way that you could modify the diet, this is not even a way of modifying diet, although we have mentioned because the diet used here will be modified, is when you change in the mode of feeding. For those who started with me, I already mentioned this. I said the normal way that we feed is oral feeding, that is through the mouth. But in some conditions, we are not able to eat using our mouth. So food or nutrients may need to be introduced in the body through other techniques. We have 2 main techniques: tube feeding, also known as enteral nutrition, or the other way is intravenous feeding, also known as parenteral nutrition. So in tube feeding, we use either commercial formulas or some blended food. And then we use small tubes, which can be inserted through various points, either the nose, nasogastric, the mouth, orogastric, or even direct to the stomach or intestines through small incisions. And then we pump the food using various techniques, the blended foods at home, in the hospital, or some commercial formulas that are bought, we introduce to the patient. This patient must have some capability of digesting the food. So the problem is just they cannot eat the food orally. Or some patients, especially in a coma where the GIT functions is not there, the patient must need nutrients as they continue to recover. So we introduce nutrients, not foods, nutrients direct to the blood through intravenous feeding, also known as parenteral nutrition. This should not worry you, because we are also going to do in one of the sessions, we're also going to do a topic called nutrition support, where we are going to look at these different modes of feeding. So in intravenous feeding, we use nutrient solutions, we use amino acids, we use fatty acids, we use dextrose or glucose, we use mineral, solutions, and then we introduce them through catheters direct into the blood veins, either in a main blood vein or a peripheral vein into the blood. This patient is not able to digest food, their GIT system is dysfunctional, and therefore we introduce the nutrients to sustain them, to give them nutrition support as they try to get well. Now I might have rushed because of time, but this is the end of our discussion today. So I think we proceed to more questions. Eric?
Yes, Annette.
We have finished our presentation. I think we should maybe answer a few questions.
Yeah, I think we can go to the Q&A, answer a few questions before we give our participants an opportunity to unmute their microphone so that they can ask a few questions.
All right.
Okay.
Now, what I'm trying to do here, this is what we have covered. This is a summary of what we have covered, just to bring your attention that we were looking at the general therapeutic dietary modifications, and those are the ones that we have covered. So I will leave that screen on so that you can be looking, and then you can be clarifying if what you have had has been covered. So we continue with the questions. So we had what advice, that one I think we had answered. Jack is also asking what will happen with the production of low insulin, high insulin. That is, we cover that in metabolic syndrome, that is diabetes. just to answer a short answer, if you have low insulin, first of all, we ask ourselves, what is insulin? Insulin is a hormone which is produced by the pancreas, in the beta cells of the pancreas. The function of insulin, very simply, it's to help in the metabolism of sugar. So insulin hormone helps move sugar from the blood into the cells, where inside the cells there in the mitochondria, the sugar molecule is now converted in a long big process, which we are not going to talk about there in biochemistry. The sugar now is transformed or converted into energy. So the work of insulin here is to move the sugar into the cell. If you don't have insulin, it means you are not going, the patient is not going to be able to move the sugar from the bloodstream into the cells to be metabolized. So that is what will happen. So when the patient has consistently high glucose levels, because insulin is low, then they have what we call hyperglycemia, which now could be proceed and become diabetes. Remember, diabetes is when a patient has elevated glucose levels. The opposite will happen. For those patients who may use insulin therapy, because if for example, if the pancreas is not able to produce enough insulin, one of the medical regime treatment is to give external insulin. You know, the injections of insulin, we introduce this so that it can perform in the work of the normal insulin. So in case sometimes the patient has very high insulin, and it will carry all the sugar from the bloodstream and put it in the cells, and the cells will use that sugar to produce some energy. But now what will happen in the blood? The patient will be left with very low blood glucose, a condition called hypoglycemia. So to answer you, what will happen with the production of low insulin? Low insulin is going to cause hyperglycemia, high sugar in blood, and then high insulin is going to cause hypoglycemia, that is low glucose in blood. Both of those conditions are not normal. They are not the normal. So that is why we treat the patient according to the condition that they have. So I think that question that I have answered. Andy, there is a person called Andy here. I will answer the question. Andy is asking, does high fiber foods have residue? Yes, that is correct. We said residue is the remains. When you digest food, what is not digested is what is called residue. So when you take very high fiber food, remember humans do not have enzymes to break down fibers, the cellulose or the connective tissues in meat. So the higher the fiber, the more the residue, the more the feces, in other words. So that's also an answer for you. Hope it's also satisfactory. Now, Jack Peter is very interested in this. He's also asking another question. What advice will you give to someone with GIT disorders? Now, Jack, I'll just still remind you that we are going to cover diet therapy in GIT diseases. Now, there are numerous GIT diseases, and the diet therapy I give for one disease is not the one that I give to another disease. So I cannot find an answer to give you generally, but the first thing is find out what type of GIT disorder the person has, and then give appropriate therapy. Just to make sure what I'm saying, very simple GIT disease. If somebody is suffering from diarrhea and another person is suffering from constipation, we cannot give the same advice, because actually what you do for diarrhea is not what you do for constipation. It's the opposite. And what you do for constipation is the opposite of what you do for diarrhea. So please be patient with us. Keep on following us. The day will come when now we start covering a topic. Well, one of today's topic is going to be diet therapy in gastrointestinal diseases and disorders. Is that okay?
I think that's okay. Annette?
Okay. Oh, let me just answer another one here I've seen. Does, I think, Siham, maybe I think what I understand by the question is, does cereal foods such as maize, sorghum, and wheat contain fiber? I think that's what you meant. Yeah, the answer is yes. When we are doing food science, because in nutrition we also study food science, we draw the structure of the grain, and the outermost thing there is called the bran. That is a fiber. Inside there is a starch. If it's a maize, there is a small germ there, which is a small thing there, has a little bit of fat. So cereals, the sorghum, the wheat, the milk, they all have fiber. But now what the food scientist does in food processing, that is why sometimes we nutritionists and dietitians may not really get along with the food scientists in what they do to food, is that when they are processing these grains, they remove the bran, they remove the fiber. And now, for example, rice, whole rice, the brown rice becomes white rice because they have removed the bran. Maize, they remove the bran. We have a very refined white flour instead of the whole maize flour. So that is why we are insisting in nutrition that depending on the condition, the healthy way to eat is to eat the whole grains. So I think also that may have answered. So Albino is asking, apart from diet therapy, do you think a patient with chronic diseases can also exercise daily? The answer is, depending on the severity of chronic disease and what disease they have, yes, they can exercise. For normal people, it is of paramount importance that we do some exercises daily. But people with chronic diseases, depending on which disease, some people may do controlled exercises. For example, just to answer you what I'm trying to say is, somebody with some cardiovascular disease, which is characterized by palpitations or a fast heartbeat or tachycardia, something like that. If they exercise, the heart is going to even beat more. It may be bad for them. But there might be some exercises that are very well in sports nutrition. When we are covering sports nutrition in higher levels of our nutrition course, we have exercise for every kind of disease, which will not make the disease worse. If somebody has gout, they are suffering from inflammation of their joints, it would be very difficult for them to do all types of exercise, but they need to do some exercise, especially to cut the weight so that they can reduce their weight and the pressure on their joints, in their ankles and their knees. But now the type of exercise we will do must be prescribed by a person who knows what is good for them. So the short answer is exercise is important, but in chronic diseases, we need to prescribe exercises that do not aggravate the condition, but rather helps. And in situations where they cannot do exercises, then it's unfortunate, but they do exist. And finally, I'll answer from Okot. For higher calorie diet, recommendation 500 calorie added, and yet the recommendation is 20 to 24 kilocalorie I don't understand the point well. Okay, let me just clarify. When you want to prescribe, when a patient needs to be prescribed for a high calorie diet, there are a number of ways to do that. So they are depending on the nutrition assessment method that you have done. You know, they are very advanced nutrition assessment. For example, if I were to use a body composition analyzer, one of the output of the measurements will be how many calories is that person requiring the way they are. So I would use that figure generated by the machine and say that the machine has said this person, the way they are, the body calories that they are taking is, for example, 1800 calories. Now, starting from that figure that have been generated by my sophisticated equipment, where I'm doing the nutrition assessment, the body composition analyzer, then I will now add 500 calories to his diet. I will sit down with that person. By the way, it's not a very simple process. It requires a lot of knowledge and commitment. I'll sit down, find out the person what they eat, and then I will tell them now, the way your body is, the machine has said you are depending on 1800, but we need to increase your calories by 500. So you now need 23, and these are the foods that you will eat. Now that is one way. Now, in cases we don't have such sophisticated machinery, we can use the body weight of the person. And we said that in high calories, in normal, the typical standards of energy requirements, we said that 25 to 30 kilograms, no, 25 to 30 kilocalories per kilogram of body weight per day is enough, is adequate for a normal health individual. But if we want to add, we will add up to 35 to 40 kilocalories per kilogram of body weight per person per day. So here we are going to work with that formula in case we don't have the sophisticated equipment. We will tell that person, you need to increase your calories, and the calories you need to consume will be 35 to 40 kilocalories per kilogram of your body weight. So if this person is 50 kilograms and we want them to increase weight, we are going to tell them for every kilogram of their body weight, they are going to consume 40 kilocalories of energy. So if you do that mathematically, a small math there, I've taken the higher levels. If you give them 40 kilocalories for every 50 kilogram of their body, you will get something like 2000 kilocalories. Now, as a dietitian now, it's when you determine the amount of energy that they need, it's up to you to plan a diet, and you say they need carbohydrates, they need proteins, and they need fat. And then you say you start carbohydrates, you plan out for carbohydrates that will provide 60 to about 60% of those calories. And then you plan for the fats. It's a long process. If you do not know dietetics, if you have not studied nutrition and you do not know dietetics, you require to go for a special course. So in one of these sessions, or if you join us, we could also do pure dietetics for you to understand, but those are very recommended. You can either add 5 kilocalories to where you have an output, a machine output, where body composition has said how much the person is eating, requiring, or you could use the other method to calculate how much calories based on their body weight. So I think we can take questions.
Yeah, we can do so. And to our participants, if you want to ask any question, you can simply raise your hand and I will allow you to unmute your microphone and ask a question to our key speaker for the day, who is Annette. You can raise your hand and I will allow you to unmute your microphone. I can see a hand up. Albino, are you there with us?
Yes, yes. Good morning.
Morning.
Yeah. I have a question, especially on the low sodium, and taking part on that is actually nutrition and dietetics. It has uneducated. You must have someone actually who study uh, anatomy, physiology, and biochemistry, all that's involved in the body. So, what can or which food can you give to someone with that? For example, sometimes they have very high sodium and it need to be controlled. So that's my question, to be precise. Thank you.
Okay, thank you very much for the question and for the comment. Yes, just first of all, I agree with you. It's true for you to understand and to actually practice, be a good practitioner of dietetics or diet therapy. You really must have done some other units. And this is our free webinar, just trying to expose you to everything that we can offer here. So it is true for you to do this, you need to do prerequisite units like human nutrition. You understand all about the nutrients and their requirements and all that. You need also to understand about a little bit, a lot about human anatomy and physiology. You need to understand about food chemistry, food science, even nutrition, biochemistry, all that. So we have just started with an introduction for you, just so that you can know what being a nutrition or dietitian means. Now, your question precisely, you wanted to know how you can control sodium in types of food. And we said sodium restriction, or you need to watch the sodium, especially if somebody has some cardiovascular disease, especially hypertension, some renal disease. You need to really watch the sodium when you have renal disease. So you wanted to know how sodium can be reduced in food. Now, first of all, we need to know what is sodium in normal terms. Sodium chloride, that is the table salt that we use. So if I needed not to have any salt in my food, I will not put any when I'm cooking. I will not add any salt to the food when I'm cooking that food. The other alternative is to use some alternative types of salt, like the sea salt, which are lower in sodium. I don't know whether you have heard of sea salt. In my country here, we do recommend that people with diabetes, with hypertension, with other conditions, gout, they may use sea salt, because if it is a true sea salt, then it is lower in sodium. The other thing is look at labels, especially those processed food. They have sodium hidden there, and it's written sodium very well in the label. So people should also have a habit of reading the label, food labels, and get to see how much of sodium is there. And if they can, avoiding now, especially if you are to eat food like bacon, sausage, processed meats, canned foods, they have hidden sodium there because of preservation. That should be avoided. And it is difficult when we cover that therapy in renal diseases. You might even observe that to reduce some salt, we even go to extreme. We cook some vegetables and we kind of rinse them out to remove some excess salt. And by so doing, we also remove some other water-soluble vitamins and nutrients, which is not very good for the patient. But it's very possible to reduce the salt by some of the measures that I've talked about. The first one is that do not add a lot of salt when cooking. Do not have the salt shaker on the table. It will tempt people to add, and check the labels. And you can use an alternative to the ordinary salt. You can use the sea salt, which has lower sodium levels. Is that okay for you?
Yes, I'm certified.
Okay, thank you.
Thank you.
Okay, before we get another question, Eric, let me just answer a simple question I've seen here in the Q&A.
Okay, okay.
From Samuel Ball is asking, what does the word bland diet means? Just to remind you, we have said bland diet means a diet that is chemically, mechanically, and thermally non-irritating to the gastrointestinal tract. It's a diet that does not irritate the GIT tract. And we said it's a chemical irritations mean it's very acidic. It does not have spices. It does not have a lot of fat. It's not too hot. It's not too cold. It's not rough. That is what is a bland diet. An example of a bland diet is like white rice that has been boiled. It meets all those characteristics. Or boiled potatoes, you know, they are not irritating. They don't have spices. They don't, you know, have a lot of fibers. That's an example. Okay. Eric?
Yeah, that is okay. I can see another hand up. We have Deng David. Deng, are you there with us? Deng, you may unmute your microphone.
Thanks a lot to Madam Annette Mambo and you, Eric. Mine is, I'm sorry, I came very late, and as I have no mic I have no any question now, but I hope at the last we still have to have the soft copy as you usually do. I'm very glad, and you know, in nutrition, it is direct to the scientific, all most of the information. So we are appreciate Madam, and we hope we still have to contact, and it's very important so that we get most of the this terminology which are other colleagues have, and it's not easy. Like if you miss anything in science, it needs to recover. So I have now to take time, recover. If there is anything not correct or anything that I have not understood at all, yes, I will still request, as I have all the links, or I have all the AG information. And thanks for now. Are you hearing me, all of you?
Yes, yes, yes. Yes, we are getting you clearly.
Thanks a lot, Madam. Also, I'm sorry, I always miss the session because it's always put on every Saturday. And Saturday sometime, yes, it's okay, but for my side, I need time to request the administration so that I follow the system. Sometimes there is maybe a cloud or rain, and then I may miss that. So I miss several of the session due to some circumstance. And I'm very happy with you, Madam. I hope you will push us, and we will be the right people at the right time at the right place in AG, which is the Humanitarian Global. And thanks a lot.
Thank you, Deng, for that. Thank you. I can see another hand up. Isaac Ditch, you may unmute your microphone.
Yes, I've already unmuted. Thank you.
Okay.
The HG team, the colleagues. Can you hear me now?
Yes, I can hear you well.
Yeah, it is actually very interesting session, and the teaching is very nice. Then only the sentiment that I have is that if the HG can have maybe some branches somewhere like in South Sudan, you know, most of the people were asking me, some guys to have get connected, but they cannot connect because of the internet. And you can have your branch in South Sudan, maybe to have as an institution that can be maybe for 2 years programs or 3 years. It will be very nice. You are very, very potential to deliver the right courses for the student to help the community. I think that's the only sentiment I have. Thank you.
Thank you for that, Isaac, and that is something we are going to take into consideration. Thank you for such a good compliment. I can see another hand up. We have Takale Teshome. Takale, you may unmute your microphone.
Hello?
Yes, we can hear you.
Yeah, you can hear me. This is Takala from Ethiopia. I really enjoyed the session for which I thank you very much. Nutrition is a critical challenge in Ethiopia, particularly for children under 5, causing stunting and wasting and severe malnutrition. And my NGO has been implementing multi-sectoral approach to nutrition sensitive agriculture, where we really focused only on the production and complementary feeding. And when I hear this session, this part of the training is critically important, particularly when you see the current massive displacement and humanitarian crisis. Do you have any experience integrating the production dimension and the curative dimension, where one fits to each other, and the preventive dimension can be more cheaper if you really create the linkage? And having said that, are there any opportunities for partnering beyond your own country? And I'm very much interested to hear this. Thank you very much.
Takale, maybe you can leave your details on the chat section, and
yeah, I did already.
Yeah, then we should be able to get back to you and have a discussion concerning that.
Thank you very much.
Thank you, Takale.
Okay, let me also answer Takale. I can see his question towards the next one, about how to integrate the nutrition sensitive agriculture and, well, whatever preventative measures. Yeah, that has been done and is also continued to be done here. One of the things that is done, we start with having a food and food security survey, where we establish how food secure communities are, what is lacking, and what to do about it, the intervention measures that can be carried. And that is now how we integrate our agricultural practices together with our nutrition. Just to give you a simple example, back some years, it was noted that the children in this region were not having enough protein in there was very high cases of protein energy malnutrition in children under 5. So one of the typical diets, I think, in this region of East Africa is some types of porridge that is offered to children because of it's easy for children to consume the porridge. So one of the intervention measures that was taken is to encourage some communities in some part of regions to integrate insect farming. Some types of special high protein insects were to be introduced to the communities, and they were to be farmed, and then they were to be processed, they were to be dried, and then they were milled and incorporated in the porridge flours of these children. In that region, the protein energy malnutrition, just because of having the agriculture linked with the nutrition, that is what you're calling nutrition sensitive agriculture, to address agriculture or food production to address the nutrition. Now that the problem went down by a very big percentage, where we saw levels reduced from around 35% of PEM in a certain, just a local study that was done, to about 17%, just because of introduction of insect farming. So that is possible, and as you have been informed by Eric, you just get in touch with the HG team, and then we can see how we can collaborate further. So thank you for that question.
Thank you very much. I really appreciate that. I have multiple interests to collaborate with you. On one hand, I am Thought for Food Ambassador for East Africa. And I'm also an Ethiopian focal point for climate smart agriculture. So this multidimensional integration might build synergy, and I will stay in touch with you. Thank you very much.
You're welcome.
Thank you for that, Takele. We are going to get back to you. I can see another hand up on it. Maybe we can take the last two questions. Okot, you may unmute your microphone.
Yes, thank you so much, Mr. Eric. Thank you so much, Madam Annette, for such a very elaborative discussion. When I came in, actually, anyway, Okot from Uganda. Yes, when I came in, it's my first time to join this platform, and I thought that I knew it all as far as nutrition is concerned, as far as things are concerned. But when Madam Annette was explaining, wow, it opened up my mind, and I felt like real. So this is all I've been missing all along. So it's such a very good discussion that you've brought on board. The only question that I have towards this webinar that we always get into, it's like, can we have like a regional integration of such kind of discussion, such that we keep on sharing knowledge and we keep on at least getting some experiences from other experts in the same field, so that we can be able to provide solutions to the needs as far as nutrition is concerned. Anyway, thank you so much, Mr. Eric. Thank you so much, Madam Annette, and thank you to everyone who sacrificed their time to be part of this discussion. Thank you.
Thank you for that, Okot, and I will show you our communities, and you will be able to join where you can share knowledge and also interact with other professionals. And I will show you how to do that just before the session ends. I can see.
Yes. Yeah, mine actually is a comment. I have three webinar sessions attended so far with your institute. Last week I was in Sudan. I attended the household water treatment, and today I attended this. The first one was nutrition in emergency. I'm actually Albino Cole, based in South Sudan. I'm a public health practitioner. I hold a bachelor degree, and as I promised last week, that when I'm in South Sudan, I'm interested in one of the courses, especially the PGD. Will share that. I don't know which one, but I will share that as public health is in general, all the courses that you have. That's why I have to attend it. Nutrition, even if you have food security, I have to go there because they are interlinked. M&E is also there. So public health is a dynamic field that all of these courses you are offering are the core principle also to be conducted in public health. So yeah, I'm impressed, and I would also share with my colleagues, those that who are not familiar with your link, so that if they are interested, they can also do that. I also to acknowledge that this technique will interest all of us to study with your institute. So thank you very much, and I will plan for what I actually promised to do. That will be on my benefit, not of your benefit, but also of my benefit if I have to study to acquire that type of
Albino?
Yes.
Thank
Are
you for
you
that.
getting me? Or?
Yes, I can hear you now.
All right.
Yeah, thank you for that. And one of our representatives is going to get back to you, and so that you can further talk about hopefully joining one of our courses. Thank you for that. And ladies and gentlemen, due to time, allow us to come to the end of our session. But before we do that, you will allow me to share my screen I hope you can all see my screen. Annette?
Yes.
Yeah, so these are some of the programs that we have here at Humanitarian Global when it comes to human nutrition and dietetics. We have the certificate level, which has a duration of about 3 months. And the cost fee is 500 USD. We also have a diploma course, which is for the intermediate. And I believe what we are doing today is a part of the diploma course. This is an introductory or a snippet to what we have in the diploma course. And the cost fee for that is about $1,000. And of course, we have the postgraduate, and this is for the expert level or people who are planning to, increase their knowledge or just go a little bit higher in the nutrition section. And for this one, we have it for a duration of 12 months. And the course fee is $1,500. And I would also just like to tell our participants that for the diploma and the postgraduate, apart from the coursework that you do, you also have a project that you're supposed to undertake. And this is a very nice way to want to gain more knowledge or just gain more experience when it comes to nutrition and dietetics. And lastly, I'd also, ladies and gentlemen, want to show you part of our website. We had talked about the communities. And so if you log in to our website, that is humanitarianglobal.com, you will see a link or just a place written HG community, and you can click on that. And that's going to direct you or lead you to a different session that we have on our website, which we call the community. And on the community is just a forum that we have for humanitarian and development workers where you can join and come link up with other humanitarians, other professionals in different fields. And you can get to interact, exchange ideas, learn from each other. And to do that, once you log in, you should be able to create an account. And once you create an account, you can join one of the groups. I'm trying to look for the nutrition one. Yeah, here it is. The introduction to nutrition group. And you can click on it and join. As you can see here, we already have a small discussion from our last time, from our last webinar that has been ongoing. So you can come here and be able to continue with the conversation of the day and share knowledge with each other and get to learn more from each other. And just also for our social medias, still going back to our website. Yeah, we have our YouTube page here. Once you can click on the YouTube page, and this is going to lead you to our page that has the different webinars that we have done so far. Yeah, so this is our Humanitarian Global page on YouTube. And if you click on the videos, you'll be able to just to see the different videos that we have done or the different webinars that we have done. We always post them here every week. Just for you to be able to see and just to use it as a reminder also. For example, our last nutrition webinar was on the introduction of nutrients, and we specifically looked at carbohydrates. And also here you get to see other courses that we have done webinars for. For example, our very last one was on WASH. That was on the household water treatment. And yeah, that is our YouTube page. So ladies and gentlemen, due to time, allow us to come to the end of our session. For those of you who are asking about the slides and the recording of the session, we shall send them to you hopefully by the end of the day. And if not, Monday morning, they should be in your emails. Just a reminder that when you registered for this webinar, we were able to get your email, and that is the email that we are going to use to send the slides and also the recording of this session. And so on behalf of our Humanitarian Global and everybody involved in today's webinar, we really appreciate you for joining us, and we wish you a good day ahead.
Nutrition and dietetics are among the major tools for development of health and basic needs of human beings in developing countries. According to WHO, Health is not only denoted as the absence of disease but a state of complete physical and mental well-being in relation to the productivity and performance of an individual. Thus, we should always aim at ensuring that every community is in good health and great nutritional status. To aid in this process, taking a postgraduate diploma professional course in human nutrition and dietetics prepared by Humanitarian Global will equip professionals with expert-level skills in this thematic area. Among the key modules and topics covered include nutrition care process. In this module, the participant will get to learn more about nutrition care process, micronutrients and macronutrients as well as nutrition assessment and surveillance. Secondly, planning nutrition interventions. In the second module, the participant will develop more knowledge on planning a nutrition intervention, emergency nutrition interventions and how to monitor and evaluate programs in nutrition emergencies. Thirdly, parenteral nutrition. This module will cover various topics areas such as parenteral nutrition, principles of human nutrition, feeding disorders and nutrition anthropology. The fourth module is nutrition counseling. This module will help the learner understand more about principles of nutrition counseling, nutrition and HIV/AIDS, nutrition information systems, communicable diseases and non-communicable diseases. Module 5 covers program design and research methods. In this module, the learner will get to develop more knowledge and skills on program design, research methods and how to foster community partnership in program planning and evaluation. Additionally, the learner will be trained on entrepreneurship in nutrition and dietetics. Our sixth module is food safety. The module offers more understanding on food safety and hygiene, health behavior change, nutrition epidemiology and food safety legislation. Module 7 covers clinical dietetics. In this module, learner develop in-depth knowledge in clinical dietetics, nutrition biochemistry and food microbiology. Module 8, which is nutrition in the lifespan. It provides the learner with more knowledge and skills on topics such as nutrition in the lifespan, nutrition and sports, nutrition education and geriatric nutrition. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.